Good morning, everyone. So we are going to learn another dry bone today, which is a sacrum. So we have bone specimen with us, right? So this particular sacrum is a vertebral bone which is fused together, 5 of them fused together to become one. This particular bone is placed in the pelvic bony pelvis or in between these two hip bones as a like a fitting structure which is placed on the posterior side of it. Now if you describe this particular bone, it's kind of like a shape of this bone is a triangular one, right? And this particular triangle have got like a base and an apex and two lateral side, we call them as lateral mass or lateral surface. So this particular region we call them as base of this sacrum, and this pointed part we call them as apex. Now base is directed upwards, apex is directed downwards, and this side is lateral side, we call them as lateral mass, also known as lateral surface, which is ending to this particular point, which is basically uniting with of the hip bone, making two joints, sacroiliac joints, right and left side. Now to describe briefly about this particular bone which is relevant for us for examination. To start with, the parts of this bone, as we have mentioned, this is having a base and it has an apex and it has lateral surface and it has two surfaces as well other than these two lateral surface, which is known as this pelvic surface and the posterior surface which is rough, which is known as dorsal surface. And on the sides on this part of the body we call them as lateral masses. So this particular central part we call them as body, and little bit extended from it we call them as lateral mass, MASS, which is leading to this particular third surface we call them as lateral surface. So if you count the surface, there are three of them: pelvic surface, dorsal surface and lateral surface. And if you count the parts of it, it has a body, it has an apex and it has lateral masses. Now to describe to it, the central part we call them as body, which is centrally placed, which is fused, you can see that. Now this body which is seeing in the like vertebrae, which is starting off S1, S2, S3 and till this S5 which is there in the bottom side. So this particular body of this S1 which has an anterior border which is prominent. This anterior prominent border we call them as promontory. You have to remember this name, promontory. Promontory, which is a important landmark, anterior border raised of this body of the first sacral vertebra, which is, you can feel it. Rest of the vertebral bodies, anterior border you cannot feel it. This one you can feel it. So this border we call them as promontory. Promontory is important for measuring the pelvic diameters, which you will become subsequently as we are going to learn the pelvis. So anterior border of this sacrum we call them as promontory, right? Right. So this particular base have got body, anterior border of it we call them as promontory. Little bit on the back side we have articular facet, we call them as superior articular facet, and this then we have this pedicel and lamina fused together forms this particular foramen which is continuous with the vertebral foramen. Here we call them as sacral foramen. So sacral foramen down to this particular canal we call them as sacral canal, which is so this opening we call them as sacral foramen, which is leading to a canal we call them as sacrum canal. Now, so we have the body, then we have the superior articular facet, and then we have the sacral foramina. Then lateral to it we have this particular lateral mass. Now this lateral mass out here looks like a wing on the superior surface, wing of a bird or butterfly, we call them as ALA, ala of sacrum. So this lateral mass, also known as this particular ala, is formed by the fusion of bony piece of this particular vertebrae, we call them as costal and transverse element. So this costal and transverse element of this particular vertebra fused to form this particular lateral mass, also known as ala of the sacrum. Now for us, as we do not know the development of this bone yet, which you have a class on subsequently, we will talk about the costal bar or costal element and the transverse element. So, for now we just remember this, the fused part of the costal and transverse elements, which makes this ala or lateral mass of this particular bone. If you can remember, it is fine. If you do not, just let go. So, it has a body, it has an ala, a supraarticular facet, and it has foramina, which is related to the bone. We call them as sacral foramina. Coming from this base, moving to this lower part, we call them as apex, which is pointed and it is uniting with the another bone. We call them as coccyx, making a joint, sacrococcygeal joint. Here we have a joint present with the vertebra above on the lumbar fifth, which is meaning making a joint, lumbosacral joint, and this particular lumbosacral joint is intervened by a cartilage. That particular cartilage we call them as intervertebral disc. So, this cartilage joint we call them as, which kind of cartilage joint it would be? Primary or secondary? Secondary, because it never unites. So, secondary cartilage joint present in here. Between this supraarticular facets and inferior articular facet of fifth lumbar vertebra makes a facet joint. Now, this particular facet joint are covered by a membrane, we call them a synovial membrane. So, this joint which is present between the facets, which is kind of synovial joint, but in between the body we have this secondary cartilage joint. Clear? Now, coming from there, talking about this particular lateral mass, as I have said, this lateral mass which is made by fusion of the transverse and the costal element. Alright. So, just do not make it, I do not want to make it complicated right now. So, remember this particular words, it is made of fusion of transverse and costal elements of bone forming elements. Now, coming to this particular lateral margin or lateral side or lateral surface, which is present on the right side, left side, and to this particular surface we call them as pelvic surface, and this surface we call them as dorsal surface. Let us talk about this particular surface features, pelvic surface. Now, in the pelvic surface, in the central part we can feel this ridges there, these horizontal ridges are there, these horizontal ridges are nothing there because of the fusion of these bones are taking place between the sacral bones, these ridges are there, which is intervened by the intervertebral disc which is present, all together they are fused. So, they are making this particular ridge because of the fusion lines between the sacral bones. Next to that we find a foramen. So, if you count that 1, 2, 3, 4 and together right and left we find 8 foramens are there. We call them as pelvic sacral foramen. We call them as pelvic sacral foramen. In between these foramens we have a bony bar. See that? In between the foramens we have a bony bar. Again that particular part coming from that developmental element. So, I am skipping that. So, between this particular foramens we have an horizontal bony bar, right, that also coming from that particular costal elements, but again just we skip that part, we remember that particular bony part which is present in here. Then we have this lateral part which is lateral mass, which is again fused part which is there, which we know that fused costal and transverse element, right. So, this particular bony bar is because of the costal bars or costal elements are there, right. If you remember, it is fine. If you don't dig deep into it. Just remember this particular midline horizontal bars, they are fusion lines of the costal vertebra, fusion lines for the sacral vertebrae. And these foramens, we call these foramens as sacral foramens. It is present on the pelvic side, we call them as pelvic sacral foramens. Now, if you flip to the back side also, we call them as dorsal surface. Dorsal surface have got features. Now, in the midline, we have a bony presence, we call them as crest. There are 3 such elevations are there. So, we call them as midline 1, crest number 1, median sacral crest. Then we have this intermediate sacral crest. Then we have the lateral sacral crest. So, there are 3 bumps are there. One is on the midline, this one, median sacral crest. Then we have this second one, we call them as intermediate sacral crest, and then we have the third one, we call them as lateral sacral crest. So, 3 bony ridges are there above down, medial sacral crest, intermediate and lateral sacral crest. Easy to remember, medial to lateral, medial and lateral, in between intermediate. Okay. Now, we have to remember how these sacral crests are formed, if you can. Okay. So, 3 bony lines are there, we call them as crest. 1, 2, 3, midline, median, most extreme, lateral, in between, intermediate. They are formed by union of this particular vertebral elements. So, this midline one, we call them as median sacral crest, is formed by the fusion of spinous process. Clear? Then we have this particular intermediate. This intermediate is formed by this union of articular facet, which is superior articular facets. You see that? So, articular facets of this one is making this particular intermediate one, and the third one, which is the lateral one, which is formed by the fusion of the transverse process. So, these 3 lines or this crest or bony elevations that is present on the posterior side, made by fusion lines of different vertebral elements. So, midline one, spinous process, then articular facet, and then transverse. In between them, we have this foramina existing to it. We call this foramina as sacral foramina, that is present on the dorsal side. We call them as dorsal sacral foraminas. And from this lateral sacral crest, this one, then we have this lateral mass, which is leading to this lateral surface. Clear? So, 3 crest and foraminas, 1, 2, 3, 4, right and left, 8. Then coming to this particular lateral surface. This lateral surface, you see that it has upper end and lower end. Upper end is wide, broad, lower end is narrow, tapered. So, upper end is articulating with the hip bone, making a sacroiliac joint. We call them as auricular surface. With the auricular end of the hip bone, it is uniting. But again, make it simple. This upper end, which is broader, making a joint, sacroiliac joint, right and left. Lower end do not participate in the joint formation, rather it gives to muscle attachments or ligament attachments. So, this upper end is broad, lower end of the lateral angle is narrow or tapered. So, this lateral mass or lateral surface is this much. Clear? So, again general features before we go for muscular attachments and anatomical position. Base, apex, lateral mass, then we have surface, 1, pelvic surface, dorsal surface, lateral surface. Lateral surface is joining with the lateral mass. Lateral mass is formed by fusions of costal and transverse elements. Now, we have this base. Base have got this particular body of S1 visible, prominent anterior border, we call them as with a special name promontory. Other than this, we have the superior articular facet of S1 vertebra visible, then lateral part we call them as ALA of sacrum, lateral part which is corresponds with the lateral mass of the sacrum bone, which is leading to the lateral surface. Now, then we have this particular posterior side having a opening, which is formed by the union of this pedicel lamina and the spinous process, making a foramen. We call them as sacral foramen. Then apex, which is having tapered, making articulation with the coccyx, making sacrococcygeal joint. Then we have this surface, pelvic surface, midline horizontal bars are there, which is union line of the sacral vertebrae. Then we have the foramens, we call these foramens as sacral foramens, pelvic side or pelvic sacral foramen. And then we have these particular bars in between this and lateral mass leading to this particular lateral surface. Then moving to the back side, we have these bumps are there, bony ridges, we call them as crest. 3 lines are there, midline, lateral line, intermediate. Midline we call them as medial sacral crest, formed by the union of spinous process. Then go down next one, we have these superior articular facets, inferior articular facets on this line. So these articular facets uniting, making this intermediate crest. Then we have the lateral one, left with the transverse process. They unite from this lateral sacral crest. In between them, we have the foramens. We call these foramens as pelvic foramens, and this is on the dorsal side. So dorsal sacral foramens. Clear? Then we have this lateral mass, and then leading to the third surface. We call them as lateral surface. Lateral surface, upper part broader, lower part narrower. Broader part articulating with the joint, sacroiliac joint, right and left. Clear? Now, coming to the muscle attachment, then we go to the foraminas. Pelvic side, we have two muscles attached, which is of concern. We have a muscle which is making E-shaped attachments on this particular areas. We call them as piriformis or piriformis. So E-shaped attachment of the muscle there on the pelvic side, call them as piriformis. And on the lateral angle, we have a muscle attached. We call them as coccygeus or sacrococcygeus. So two muscles on the pelvic side, pelvic surface, piriformis or piriformis. Then on the lateral side or lateral angle here, we have a second muscle attached. We call them as coccygeus because it is attaching to the sacrum, sacrococcygeus, which is a muscle related to the pelvic diaphragm. We will talk about pelvic diaphragm. A component of the pelvic diaphragm is this one, which is important for us. Two of them, we remember this. There are several other relationship is there, but we skip this at this point because we do not know the organ itself. So two muscles attached on the side. Piriformis, sacrococcygeus. Just coccygeus if you remember this, because we may miss because we are reading sacrum. So add the word sacrococcygeus, which is important for us to remember. Flip it on the back side. In between this side, we have two muscles attached in the posterior side as well. We have a muscle, we call them as erector spinae and multifidus. So between here over this particular foraminas, which is dorsal sacral foraminas, we have a muscle attached. We call them as erector spinae, and lateral to it we have a muscle attached. We call them as multifidus. These are the two one. If you remember, it's fine. Later on, as we move to the pelvic muscles, we will talk about this particular muscles related to it. Especially the erector spinae is important for us. Erector spinae have a submuscle, we call them as multifidus. They are related to the back side. They are helping to keep the spine erect. That is why they are known as erector spine. They are present on the dorsal side or back side. So they contract and make this particular spine erect. So that is why they are known as erector spinae, and multifidus is a sub-component of erector muscle, erector spinae muscles. So these are the two elements of the muscles that we have to keep in front side and back side. And on these lower margins, we have this gluteus maximus. Remember the gluteus maximus in the hip joint? We have this particular muscle on this side as well. It has a tiny attachment point as well. If you remember, that's fine. If you don't worry. Clear? Now, coming to the foramens, that is important for us to remember here. Now, coming to this foramen first, which is important for us to remember, which is complicated, we will talk about it. So, we have a foramen on the back side, we call them as sacral foramen. Sacral foramen leads to a tunnel, we call them as sacral canal, which is continuous with the vertebral canal. So, this particular foramen leads to a canal, we call them as sacral canal. Sacral canal ends to this particular U-shaped or inverted U-shaped canal or opening, we call them as hiatus. So, this particular hiatus which is present in here, we call them as sacral hiatus. So, three things we have to remember here: sacral foramen, sacral canal, sacral hiatus. So, the spinal cord or the nerves are coverings of it getting through this particular vertebral foramen to this particular sacral hiatus, entering to this particular canal, we call them as sacral canal, and then exiting through this particular hiatus, we call them as sacral hiatus. So, this particular sacral canal, at this point we see that there is a deficiency or gap is there. So, this particular gap or deficiency is because of the lack of fusions of the inferior articular facets. So, which is making this particular hiatus like this, inverted U shape. If you remember, that is fine. Why and how these particular openings are formed, it's okay. If you do not remember, just don't forget the name of it, and the significance of it will be coming into it. So, this opening we call them as, and this inverted U shaped opening, in between them we have a canal, we call them as, this is a bony canal, purely covered by bone. If we do not have this bony covering, we have a diseased. If you do not, if this particular bony canal is not there, say for example, if by any problem happens to this ossification or unification of this particular bony elements is there, that can lead to opening of the sacral canal. So, then we have a clinical problem. We will talk about that. We call them as spina bifida or bifid spine problem. So, we will be talking about that in the developmental classes, right. So, just remember the names for now: opening, above, foramen, canal, hiatus. Clear? Now, what structure gets in, what structure present in here, and what structure comes out of this particular foramen, canal and hiatus. Through this particular foramen, sacral foramen, we have this particular bunch of the spinal nerves, which is sacral nerves, coccygeal nerves gets in, covered by meninges. That means we have the dura mater, arachnoid mater, pia mater covering here, going in. So, they are getting in through the foramen, they are running through the course of the canal, and then through the hiatus this three structure comes out. One is the fifth coccygeal nerve or coccygeal nerve, fifth sacral nerve, and a remnant or continuations of this covering, we call them as pia mater, as phylum terminal. So, if you cannot remember the words like phylum terminal, because we haven't learned about spinal cord covering dura mater yet, now we will be covering that in the neuroscience classes or in block 3, or what is that called, semester 3. So, for now we just talk about this particular nerve which is exiting through the hiatus is the fifth sacral nerve, coccygeal nerve, and a covering or remnant covering of the dura mater, which is known as phylum terminal or pia mater fold, which is going out through the hiatus. So, through this canal is going on the spinal cord nerves, which is known as spinal nerve, which is coming in here, all the sacral nerves, coccygeal nerves, and a covering of the meninges. They are traveling through the course, some of the covering of the dura mater or some of the covering of this arachnoid or some of the spaces we lose it in this particular canal. Exiting through the hiatus is three structure: fifth sacral nerve, coccygeal nerve, and phylum terminal. What is phylum terminal? A continuation of dura mater or spinal meninges or meninges remnant. If you just do not remember the word for that examination or during that time, just remember the word is a meningeal continuation, continuation of meninges which goes in here, right. So, three things gets out of this particular hiatus. Now, coming to this foramens, dorsal side and the ventral side. Now, you remember what happens to the spinal nerve? Spinal nerve, once it gets in, splits into two branches, we call them as rami, ventral rami and dorsal rami. So, they are going on the ventral side of the body like anterior part, and going on the dorsal side, back side, going to supply the muscles, skin, etc., etc., nerves, blood vessels, etc. So, this spinal nerve, like which spinal nerves? Sacral spinal nerves. How many spinal nerves are there? We have 5 spinal nerves there, 1, 2, 3, 4, 5. So, 1, 2, 3, 4 spinal nerves splits into dorsal rami and the ventral rami branches. The dorsal rami and the ventral rami exits through this sacral foraminus. Getting it what I am trying to say? We have spinal nerves. Spinal nerves, once it gets out of this particular intervertebral foramen, splits into two branches, anterior branch posterior branch. Anterior branch we call them as rami, anterior rami, and posterior branch we call them as posterior rami. So, this anterior rami and posterior rami out here is will be sacral spinal nerve. So, sacral spinal nerve have 5 pairs of them. So, this particular 5 pairs of the nerve splits into branches. Our upper 4 splits into this anterior rami, ventral rami. The anterior rami exits through this pelvic sacral foramina, and dorsal rami exits through this dorsal pelvic or sacral foraminas, and goes subsequently to supply these particular muscles, skin, nerves, etc., blood vessels. Fifth one remains undivided. What happens to the fifth sacral nerve? It exits to the sacral hiatus. So, this complex information regard to this particular foraminas we have to remember for our examination. So, spinal nerves, which is a mixed kind of nerves. The spinal nerve comes out and splits into 2 branches. It comes from the spinal cord. So, this is a spinal cord, and each of the spinal nerves comes from this particular segment. The spinal nerve in the segment which is coming from the sacral segment gives rise 5 branches of it, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. Now, this out of this 1, 2, 3, 4 spinal nerve splits into rami branches, anterior rami, posterior rami. This one too, anterior rami, posterior rami, anterior, posterior, upper 4. Fifth one remains undivided and exits through the sacral hiatus. Remember that 4 of them splits into 2 branches. How does this particular rami exits? Through this particular pelvic sacral foraminus and dorsal sacral foraminus, right. So, this anterior branch or anterior rami exits through this pelvic sacral foraminus, posterior rami exits to dorsal sacral foraminus. So, this is how this particular spinal branches of the sacral nerve exits through here and subsequently go and form this plexus like lump, sacrococcygeal plexus, or going to supply these particular organs, or going to supply the muscles or skins, etc., etc., right. So, this particular thing about this particular how this particular sacral foraminas are transmitting this particular nerve, that you have to keep in mind, that you have to remember this. Again, this will be reinforced as we are going to study in the spinal cord and this particular spinal nerves and the distributions of it. We will talking about it. So, remember this, out of this particular 5 pairs of the sacral nerve or sacral spinal nerve, 1, 2, 3, 4 splits into anterior and posterior rami. Fifth one exits through the sacral hiatus undivided. Once it exists, later on it splits. What do? They forms a network of connections. We call them as plexus, sacropelvic plexus or sacrococcygeal plexus, and then they form these particular regions on supplying these different regions. So, this particular spinal cord has a covering to it. The covering of the spinal cord we call them as meninges. Meninges have got 3 layers. Outside one we call them as dura mater. The inner one we call them as pia mater, and the middle one we call them as arachnoid mater. In between them we have spaces. Outside the dura we call them as extradural space. Between this dura mater and arachnoid mater we call them as subdural space. Between the arachnoid and pia mater we call them as subarachnoid spaces. So, this particular layers of this particular meninges hold some spaces along with it. So, this particular meninges layers or dura mater, arachnoid and pia mater ends at different levels. So, this particular pia mater continues beyond this particular dura layer or arachnoid layer. So, this pia mater ends at S2 vertebral level or tip of the coccyx. Sorry, this particular dura mater and arachnoid mater ends at this particular S2 level or S2 vertebral level, whereas this particular pia mater continues to coccygeal level or coccyx 2 level, attaches to the coccyx level. So, this pia mater which is continues down through this particular foramen, we call them as sacral hiatus, we call them as phylum terminal. So phylum terminal is nothing but continuation of spinal pia mater, which ends on the coccyx bone, whereas the dura mater and arachnoid mater ends beforehand, ends before that. Other than this, we have another word, we call them as chorda equina. So what do we mean by the chorda equina? This is a Spanish word. We call this chorda equina as a horse's tail. So what happens? Our spinal cord ends at junction of L1 and L2 vertebra. Alright. So this particular spinal cord lower border ends at the level of lumbar vertebra. Which lumbar vertebra? Junction of L1 and L2 in adult. Now this particular spinal nerves beyond this particular lower level of this particular spinal cord goes down through these particular foramens. Which foramens? This foramens. Spinal foramens, pelvic sacral foramens, or this particular foramens which is related to this particular intervertebral foramens. Now as you see this particular spinal nerve beyond this L1 L2 junction, they are hanging down to exit into this particular intervertebral foramen. They look like a bunch of tail of horse. So this particular spinal nerves of the sides beyond the L1 and L2 vertebra, we call them as chorda equina, C-A-U-D-A, chorda equina. So this particular chorda equina is a bunch of spinal nerves which is lying at the level of or beyond the level of lower end of the spinal cord, which is lying at the junction of L1, L2 vertebra. So this spinal cord, we have classes or specimens, we will learn that particular spinal cord in third semester. Then we will be coming again about chorda equina and this particular significance of this particular dura mater, how and where exactly the dura mater different layers ends. We will be learning that again. So for this particular bone, as it is related to the spinal cord, spinal nerve, spinal areas, we have to introduce these particular words. So you may forget, you may become like not being able to recollect all the things right now completely 100%, but you have to understand what this particular pelvic sacral foramina are made for. This is for exiting this particular sacral spinal nerves, ventral rami and dorsal rami. You should be able to identify this particular difference between this particular sacral foramen, sacral canal and sacral hiatus, and what this particular sacral hiatus transmit, which is the fifth sacral spinal nerve, coccygeal nerve, and continuation of the pia mater, which is going down as a thread like structure. We call them as phylum terminal or phylum terminal. And this is enough for us to talk about this particular bone in just general feature, muscle attachment and the significance of the foramens. Now talking the last thing about this particular thing is holding this particular bone in anatomical position. So above is the base, down is the apex. The smooth pelvic surface is anterior and rough dorsal surface is posterior. Now this particular pelvic surface is directed forwards and downwards. So this is an easy bone to have this during examination, an easy one to have this particular bone in anatomical position, because so you have to just like keep this particular pelvic surface forward then downwards, as if sacrum is picking up something from ground, as if sacrum is picking up something from ground. So it is tilted down, pelvic surface forward, dorsal surface backwards, base is above, apex is down, pelvic surface is directed forwards, tilted down, as if your pelvis is picking something from ground. You have this one bone piece midline, so you have to just like keep it in one hand and demonstrate. Clear? Doubts? Queries? Okay, write down the question.